Hi there, I'm Dr. Chung and welcome to your friendly proctologist. Thank you so much for watching today. This channel is about giving real, useful, and helpful information to help you deal with your bottom end issues. In the description box below, you'll find links to my most frequently prescribed or recommended products you can get over the counter. The links greatly benefit the channel and I appreciate you helping out. The final thing I want to mention is there's details in the description box if you'd like to have a video consultation with me. If you feel like your questions aren't getting answered, they're not listening to you, or any other concerns, allow me to listen to your story and give my piece or take on your situation. So with that out of the way, let's talk about today's topic. And that topic is, how do I know I'm going the right amount? Meaning, how do I know if I'm pooping enough, right? And there's so much garbage out there on the internet. You know, they're really just trying to sell something to you, but they give you terrible information with it. Some will say, if you're going once a day, you're healthy. And then the other way they'll say it is, if you're going 3 times a day, then you are unhealthy, okay? Even if you feel great, right? And so what's the deal with that? Where are they getting that from? And it is a bunch of quackery. I'll tell you that right now. And so let's go through a list that I have prepared for you today. And the list has 6 ways of knowing that you are going the right amount, okay? So I want these to be useful and helpful so that you can quickly check and see how you're doing. And of course, seeing your physician is always the best way to get that physical examination and any lab testing that may need to be done. But here are some really helpful and off the bat useful tips. Okay, so number 1 is that you're able to eat your meals every day like you always have been, okay? And so if you are not able to eat as much as you used to, you know, I'm talking about the last year, if you're starting to feel backed up or anything like that, then you may find that your meals are getting smaller or you feel full easier, okay? Because if you have backing up of poop or gas, your belly is going to fill up more and it won't want to allow more stuff in. It's kind of like the intestines know that more input is being put in through your mouth, and it is going to give you signals that say, you know what, no, we need to process and evacuate this stuff out first, okay? And when you see that you are not keeping on weight, you know, because you're not eating well, because you're not eating as much, or you feel like you get really full really fast, that's a sign that maybe you aren't pooping as much, okay? It's also a sign for a lot of other things, might I add, okay? It's a very non-specific symptom, but I want to give you 6 different things to put together and see how you're doing. The next thing on the list is that you don't have any nausea or vomiting, okay? So you don't feel nauseous while you're eating or even when you're not eating throughout the day, okay? The nausea from the intestinal system typically is because the stretching of the intestinal wall. So the intestines, you know, like the small intestines should really be like about 2 centimeters in diameter. But as that gets filled with food, it gets wider, right? It's starting to hold more of that food that's being digested. But if it gets too big, things start to say, hey, we're slowing down the train. Then you can imagine that those intestines will start to grow a little bit more in size because things are backing up. They don't want to go forward, and everything about your intestinal system wants to just flag things through, okay? So if you get the stretch to be too much, that's when those nerves from the intestine will feed back to your brain and tell your brain, hey, we've got a backup issue, there's a roadblock, we need to stop, right? We need to stop eating or what have you, or we need to tell the body, we have a problem here, and the way it feeds that signal back is that it starts to make you feel nauseous, like you've got things that are just sitting there and not moving, okay? So that's number 2. Number 3 is that your belly is not bloated, okay? When you don't go poop very often, of course the blocks of poop are going to be throughout your colon, or it may not even be dry. It may just be a backup of quantity of poop. Poop produces a lot of gas, and that gas also adds to the factor of being dilated, or those intestines stretching out. Now, your colon, usually you have about 6 feet or so of colon. So when you have this amount of colon sitting in your intestine and now it's enlarged, okay, then it's going to take up more room in your belly, and you're going to see it show on your skin. You're going to look down and you're going to say, oh my God, I can't see my belt buckle anymore. It's hard for me to bend my knees and tie my shoelaces. Like, I feel my belly has grown on me. And yes, putting on weight could be one thing. And so again, these symptoms are very generalized, non-specific, meaning if you have one of them, it doesn't automatically mean that you have constipation or slow transit of food, things moving slowly. But it is a sign that you should watch out for. All right, so what's another one here? Is that you don't have any belly pain. If you have backing up of poop in your body, you're going to get that, again, the distension, the enlarging of your intestines. And like I said before, it makes your belly look bigger. It can make you feel nauseous and make you vomit, but it'll also give signals of belly pain. So a lot of belly cramping. And where can you get belly cramping? Well, I find people with constipation actually get a lot of belly pain on the right lower side of their belly, okay? It's not 100% of the time, but when they get that there and they're telling me that they haven't pooped for a week, I'm checking on the right side and I usually find that there's pain right there. Or the patient is telling me, I've got pain on the right side. It's weird, doctor. I feel constipated, but why is it on the right side? And so I'll find that their belly is a little bit blown up and that pain is there, okay? And again, that's because the intestines have been blown up and the nerves are telling the brain something's wrong and I don't like it, and I'm going to give the body the message that something needs to be fixed, okay? All right, so what about another sign? Number 5 is that you don't have any pressure in your rectum or down by your tailbone area or the back of your sacrum area. And so when you get a very impacted piece of poop, right, what that means is essentially a trash compactor compressing a ton of poop in your rectum, and it's been sitting there for a long time and it just keeps getting bigger and getting more bulky. The rectum gives signals to the brain just like any other intestine, but it gives the sensation that there's fullness, pain right around your anal rectal area. Your tailbone could even be having pain, or the low back, where it almost touches your tailbone. That area may feel really oddly sore and full and like back pain. You're kind of stretching things out, but it doesn't get any better. But you haven't pooped in a while, okay? And that's the kind of pain or pressure that I'm talking about in your rectum. Definitely if you have that going on, it's very easy check by a doctor. They just do a finger exam and they'll immediately be faced with the wall of poop. And that happens to many people. I mean, it's a very common finding, especially people that haven't pooped in a while. Let's say after surgery, you've been taking a lot of narcotic pain medication because anal surgery hurts, but You haven't been coached on how to poop right, and so you get these kinds of issues, okay? So what about number 6? Number 6 is that you don't need to use suppositories like laxative suppository like bisacodyl, or you don't have to swallow or take any laxatives to go poop, okay? I want to clarify this, and I've done videos like taking Miralax or stool softeners every day, and that is to prevent these kinds of things. But that in a routine fashion, every day taking a little bit, is much different than someone who doesn't take anything at all and only uses it for emergency situations, okay? So if you're the type of person that does not need to take any emergency extra laxatives to go poop, then you're doing okay, all right? Because some people, they need to take an enema. They'll do suppositories like bisacodyl. They'll do Docalax, whether it's suppository or by pills, or they'll have to take a lot of Miralax several days in a row in a big quantity in order to finally let it out, okay? And that's because you're backed up and things are, now you're trying to jumpstart things again. And you should not have to do that if you're going enough, okay? So these 6 things on the list here are just a really quick way of knowing whether or not you're doing okay in general with your bowel movements. I'd say if you are not having any of those problems, your body is doing fine. Continue enjoying your life and make sure you get your colon cancer screenings when you're 45 or earlier if you have any other risk factors. Or just get a regular health checkup with your medical doctor. If you feel like you need the specialist to ask some really particular questions, I'm always available to you by video consultation, or schedule a visit with your proctologist or specialist. And with that, I really appreciate you being here. Thank you so much, and I see you in the next one. Bye-bye.